Hello, everyone, and welcome to week 8. We are now in our last week. It's surprising how quickly this semester has gone by. So this week, we're going to talk about chapters 15 and 16. I won't go over all of this week's objectives, but we're going to be talking about intentional and unintentional injuries, as well as occupational injuries and occupational diseases. There are a few items that are due this week. You have your Triangle Fire blog. You will be brainstorming safety at Harper, and this will be a wiki. Chapter 15 and 16 quiz, of course, your discussion board, and the advocacy letter that we have been working on over the past few weeks. In terms of the Triangle Fire blog, the purpose of this assignment is to identify what events led to the Triangle Fire and to gain an understanding of the historical events that led to current workplace safety regulations. In order to complete this assignment, you will have needed to watch the video on the Triangle Fire, which is available on Blackboard. After viewing the video, I would like you to reflect on the following questions. What events led to the Triangle Fire? And how did this event contribute to current workplace safety regulations? The second assignment is brainstorming how Harper creates a safe environment for students. What you will do is research the different ways Harper College creates a safe environment and evaluate what it means to feel safe and be safe at a college campus. To complete this assignment, you will have to visit Harper's website to discover the different ways Harper makes and creates a safe environment for students. And actually, you could include faculty, staff, employees, and the community as well. For this assignment, I'd like you to list and describe 3 ways Harper creates a safe environment for students. Be mindful and try not to repeat what other students have listed. This brings us to chapter 15. Some of the terms you should be familiar with are injury, which is physical damage to the body resulting from mechanical, chemical, thermal, or other environmental energy. Unintentional injuries are injuries that occurred without anyone intending that harm. And intentional injuries are injuries that have been purposefully inflicted either by the victim or by another person. Injuries cost society a lot of money. It is the leading cause of death and disability in the world. It's estimated that over 5 million people die each year from injuries. Fatal injuries are injuries that result in 1 or more deaths. And disabling injuries are injuries that cause any restriction of normal activity beyond the day of the injury's occurrence. So if I get a paper cut, let's say, it would not be disabling because I'm still able to resume my normal daily activity. Unintentional injuries are the cause of nearly 2/3 of all injury-related deaths in the U.S. And there are different categories or types of unintentional injuries, which include poisonings, motor vehicle crashes, falls, and other types of unintentional injuries. Poisonings are they were the leading cause of unintentional injury death in 2014. It could be the unintentional ingestion of fatal doses of medicines and drugs, the consumption of toxic foods, or the exposure to toxic substances in the workplace or elsewhere. However, most poisonings do occur at home. Motor vehicle crashes are the second leading type of unintentional injury death. And when we look at who is fatally killed during these incidents, most of those that are killed are drivers, passengers, motorcycle riders, pedestrians, and pedal cyclists, so bike riders. Falls are the third leading cause of unintentional injury death. The leading cause of injury for falls are related to a medically consulted injury. For example, if I've had hip replacements and I fall, that would be a medically consulted injury. Again, most of these occur in the home, and a disproportionate amount of falls that impact the elderly. This could partially be due to the lack of mobility and lack of stability, loss of muscle mass, or it could be due to osteoporosis where the bones become weakened and as a result, they fall. When we look at alcohol and other drugs as risk factors, alcohol may be one of the most important factors contributing to injuries. It's involved in a high number of motor vehicle crashes, which are related to speeding, seatbelt use or non-seatbelt use, and other behaviors. When we look at prevention through epidemiology, we see our triangle again. However, the points now have different terms. We have energy, host, and environments. Energy is the producing agent. So what produced the injury, the unintentional injury? The environment is where did the injury occur, and then the host, of course, is the person it occurred to. We look at prevention and control tactics based on the model just presented. What it would look like is to prevent an accumulation of an energy producing agent, or what caused the unintentional injury. To prevent an inappropriate release of the excess energy, you can place a barrier between the host and the agent, or you can separate the host from potentially dangerous sources of energy. We look at community approaches to the prevention of unintentional injuries. There are a few ways this can be approached. One is education, which is the process of changing people's health-directed behavior through educating them on the dangers. As I'm sure you can think about the home, when you think about growing up, maybe there were locks on the cabinets to prevent kids from getting into dangerous chemicals and cleaning agents. There are large education programs to help make parents more aware of how to keep dangerous chemicals out of the hands of children and toddlers. Then there's regulation. And this is enacting and enforcing laws to control behavior and conduct. Automatic prevention is modifying products or environments to reduce the risk. Think of medicine bottles, prescription medicine bottles. They are now created so that they are child-proof, which makes them difficult to open for children. And then litigation is seeking justice for injury through courts. When we look at intentional injuries, so these are injuries that were caused on purpose. It could be the outcome of self-directed, so I'm causing the injury to myself, or interpersonal violence. And it is a community health problem in the United States. The different types of intentional injuries include assaults, rapes, suicides, homicides. These can be perpetrated against family members, community members, or complete strangers. It's costly to society and to individuals due to loss of life and productivity, economic costs to the community. We look at the epidemiology of intentional injuries. Interpersonal violence disproportionately affects those frustrated, hopeless, jobless, living in poverty, and with low self-esteem. More acts are committed by males. Firearms are increasingly involved. Alcohol and drug use contributes to interpersonal violence. And when we look at who commits the violence, perpetrators more likely have to experience abuse or have been neglected as children or have been exposed to violence as children. In terms of suicide and attempted suicide, the suicide rate for men are 4 times that for women. Generally, women attempt suicide more often, but men are more successful at suicide. We look at the forms of suicide, women are more likely to use pills, and men are more likely to use firearms. The suicide rate for young people increased between 2009 and 2013 to the highest rate in 10 years. When we think about what was going on between 2009 and 2013, there was an economic depression. That may have led to the increased suicide rate among young people. And then suicide rates for elder men are the highest for any population subgroup. When we look at firearm injuries and injury deaths, these can be both intentional and unintentional acts. Firearms are the third leading cause of injury death. The highest risks are for homicide and suicide involving firearms are teenage boys and men. There has been increasingly reports of guns on college campuses. And currently, there's an absence of detailed federally supported reporting system. The federal government does not support, in terms of economically or grants or giving money to, studies involving firearms. Violence in our society and resources for prevention. We have to be able to look at individuals and violence. We need to be able to address family violence and abuse, which includes child maltreatment. And child maltreatment falls into two categories. One is child abuse and one is child neglect. So child abuse is physical harm or mental harm to the child. Child neglect is neglecting their basic needs. Elder malnutrition or maltreatment and prevention, and then intimate partner violence. This brings us to chapter 16. Globally, each year, there are 370 million non-fatal occupational injuries and 321,000 fatal injuries in the workplace. When we look at where Americans spend their time after being at home, Americans spend most of their time at the workplace. And these are followed into two categories: occupational disease, which is an abnormal condition other than an occupational injury caused by exposure to environmental factors associated with employment. It could lead to occupational illness. Occupational injury is an injury that results from exposure to a single incident in the work environment. Because of this, occupational safety and health to the community are important factors when we think about community health. The industry, the workforce industry, is a subset of a larger community, and in fact, it creates its own community, the workplace community. It includes those impacted at the workplace and those outside of the workplace. And workers themselves, as I mentioned, are a community. In 1970, they enacted the Occupational Safety and Health Act, which is the OSHA. The purpose of this act is to ensure employers and private sector furnish each employee a workplace free from recognized harms causing or likely to cause death or serious physical harm. The Occupational Safety and Health Administration was established to enforce OSHA. When we look at unintentional injuries in the workplace, there are minor injuries, such as cuts, bruises, abrasions, minor burns, and then there are major injuries, amputations, fractures, severe lacerations, eye losses, acute poisonings, and severe burns. These are reported by many sources at the workplace. Fatal work injuries are most common in the transportation industry. Other industries with higher rates of fatal occupational injuries include agricultural, forestry, fishing and hunting, mining, construction, and again, transportation and warehousing. When we look at workplace injuries by industry and occupation, fatal occupational injuries by industry. Logging is the single most dangerous occupation in the United States. Mining has the second highest fatality rate. So it's important to focus on the prevention and control of unintentional injuries in the workplace. And there are 4 fundamental tasks to achieve this: anticipation, recognition, evaluation, and control. We look at Workplace violence. So this is intentional workplace injury, so things that were done on purpose that were meant to cause harm. Each year, there are almost 2 million victims of workplace violence. Homicides are the fourth leading cause of workplace fatalities. And there are 4 categories of workplace violence. There's criminal intent, which is type 1, customer clients, which is type 2, worker on worker is type 3, and then personal relationships would be considered type 4. Risk factors that place someone at higher risk for intentional injuries in the workplace include working in a job where you work in the public or with the public, working around money or valuables, working alone, working late at night, and then jobs with the highest risk are taxi cab drivers, jobs in liquor stores, and detective and protective services. Next, we're going to talk about occupational illnesses and disorders. Illnesses are more difficult to acquire data on than injuries because injury is caused by a single event or a few events, but they are easy to document. Illness is more difficult to document. It's difficult to link an illness to occupational exposure. What exposure led to the illness? In addition, to compound the difficulty in assessing where the illness came from, some conditions are slow and take a long time to develop. So it may be difficult to ascertain, did this condition, is it a result of something you were exposed to 10 years ago, 20 years ago, 5 years ago? Other work-related diseases and disorders include poisoning. These are common amongst agricultural workers, infections, which are more common amongst healthcare industry, and then exposure to hazardous drugs. In terms of prevention and control of occupational diseases and disorders, it really requires vigilance of the employer and employee. Employees also have to make common sense decisions. We look at the agent-host environments model, which you have been presented with a few weeks back. And some examples of activities meant to prevent and control occupational diseases and disorders include identification and evaluation of agents. So what agents or chemicals or biologics are on the premises that may result in a dangerous situation. Creating a standard for the handling of and exposure to causative agents. Some jobs require you to work with agents that are known to cause illness or injury or harm. And so they need to put place procedures on how to safely handle those agents. Engineering controls, environmental monitoring, and medical screening are all ways to prevent and control occupational diseases and disorders. There are resources for the prevention of workplace injuries and diseases. There are occupational safety and health professionals. These include safety engineers, certified safety professionals, health physicists, industrial hygienists, occupational physicians, and occupational health nurses. When we look at workplace health and wellness promotion programs, this is becoming increasingly popular as workplaces are trying to promote health in order to prevent disease later on. When we look at health and wellness promotion, we can identify it as total worker health. And these are policies, programs, and practices that integrate protection from work-related safety and health hazards, and a promotion of injury and illness prevention efforts to advance worker well-being. Some companies offer employee assistance programs, and these are work-based programs that assist employees who have substance abuse, domestic, psychological, or social problems that interfere with their work performance. This concludes our video for week 8. Please do not hesitate to contact me if you have any questions regarding any of the assignments this week. Have a wonderful week.